I would now like to introduce our first priority lead, Delvina Gorton. Delvina is the National Nutrition Advisor for the Heart Foundation and a registered dietitian.
Great, thanks very much Hayley. Kia ora, hello everyone. So I'd like to introduce the first priority area in this vision, which relates to food security or food poverty. And the vision we have here is for all people living in New Zealand to have sufficient access to healthy food that's affordable and safe to eat. But for many of us, we know the reality at the moment is a little different to this vision. It's really tough for people trying to feed their families to afford the food they need and the food that we'd like them to be eating. The last data we have on food security was from the 2008-09 Adult Nutrition Survey, and we know from that that 2 in 5 households in New Zealand aren't food secure or lack food security. But we also know that it doesn't have to be that way, and it's not the future that we see in this vision for the next 10 years. We can have a New Zealand where every family would be certain that they have enough nutritious and affordable food to feed themselves and their family, but also a place where children grow up not just learning about the physical value of nutritious food, but also its social and cultural value. And it would also be a place where nutritious food was the easiest to obtain because it was more accessible and more affordable. So the solutions to creating this vision mightn't be easy or they mightn't be straightforward, but it is something that needs action and commitment at multiple levels. What we have in the vision is 5 priority areas that can make a strong contribution towards achieving this part of the vision. And I think they're all things that we can all start working on in our communities. So the first action was prepared by Kelly Corrigan from Toi Tangata, and that is to support and strengthen the capacity and leadership of whānau and communities to improve access to safe, healthy and affordable food. So really this is about starting with communities, supporting and building the capacity and leadership within them, so helping whānau to work toward their own solutions and helping set them up to win at doing that. The second action is to bring together a cross-sectoral coalition to work collaboratively and take action to improve affordability and access to healthy food. So this section was prepared by Sarah Stevenson, who was at Toi Te Ora Public Health at the time, and in this action area she was thinking of food policy councils. So that's something that are fairly common internationally, not so much in New Zealand, but they're basically a coalition of relevant stakeholders, including local government, and they work on coordinating local solutions to improving affordability and access to healthy food. So examples of some of the things that they've worked on overseas would be things like a not-for-profit fruit and veg delivery boxes, community gardens, community kitchens, food co-ops, those types of things. Moving on to the third priority area, that's to encourage and support all members of the food supply chain to do their part in ensuring healthy foods are available, affordably priced and widely promoted in stores. And this is prepared by Vicky Robinson. So obviously the food we buy and the price we pay for it is determined by multiple inputs along the food supply chain, from grower through to retailer. And because they do supply so much of the food, we do need them to be part of the solution. A couple of examples would be low-income areas. We know the food most available and affordable often isn't the healthiest. And an example of activities that have been done to promote that would be something like Healthy IGI. We've also just seen supermarkets cut prices on bread, so great that they're trying to reduce the volume of staple foods. What we need is for that to be happening on the healthier varieties of bread. Moving on to the fourth action, so this relates to environmental policies for safe and clean food and water. It was prepared by Jenny Game. So this is about ensuring that the kai that we grow and gather is safe to be eaten. So whether it's gathered from the sea, shoreline, our rivers, forests or public spaces through food foraging or guerrilla gardening, we want that food to be safe and edible. It's also about supporting the return to traditional food collection practices so that people are able to learn and retain their skills. And finally, the fifth action is about building an evidence base on what works and what doesn't, so that we can learn what the success factors are. We know a lot of the factors that are associated with a lack of food security. We know the theories on how to promote health. Now we really need that sort of solution-oriented research and interventions that draws that all together to implement solutions. So moving on to where to start and what can you do. So the first point is to mobilise. So mobilising people within your communities to start getting involved and engaged in issues related to food security. Instigating a food policy council is a great way to start, identifying relevant groups and starting the discussion. If you wanted some ideas around this, Toi Te Ora Public Health on their website have a food security toolkit which focuses a lot on working with local government through food policy councils. Also starting local with the food supply in your area. What projects are there that can start building a positive relationship with food providers and working on win-win solutions? And advocating for clean environments. Now's a great time with the election coming up to start getting a voice heard. Labor's released its policy on fresh water quality, and Gareth Morgan's got a campaign going about minimum water quality standards, so there is action happening out there that can be leveraged. And lastly, evaluating what we do, sharing it and learning from what each other has done and achieved. So thanks very much, and I'll hand back to Hayley. Kia ora.
Great, thanks Dalvina. I would now like to introduce our second priority lead, Carolyn Watts. Carolyn is a director at Quigley & Watts and is an experienced public health researcher and evaluator.
Kia ora, Hayley, thanks very much. Kia ora koutou. I'm going to introduce priority 2 for you. I'd just like to acknowledge before I get started the other members of this team who were Liz Cutler, Marianne Carter and Anna Pacera. So priority 2 is all about ensuring children are free from exposure to food and beverage marketing messages. In New Zealand, children live in an environment where unhealthy food is more heavily promoted, more accessible, and for the most part cheaper than healthy food. Children are bombarded with messages about what to eat. These messages are reaching families in their living rooms, at school, through fundraising activities, at sports groups and other places where children and families gather, so just about everywhere. Marketing messages have also become increasingly sophisticated. So it's no longer just marketing on TV that we're thinking about. The World Health Organization has a definition for marketing, which is quite long, so I'll just read it out for you. So it's any form of commercial communication or message that is designed to or has the effect of increasing recognition, appeal, and or consumption of particular products or services. So this includes advertising, both the broadcast and non-broadcast advertising. It also includes product placement and branding, for example, on children's books. Sponsorship, direct marketing, and an example of this would be money off vouchers that we see quite often. Product design and packaging, and also point of sale marketing such as loyalty schemes. So despite evidence that the current New Zealand self-regulatory system is not effectively protecting children, there's been a great industry pressure to retain it. The World Health Organization has recently released a couple of reports which are detailed in the vision, and they recommend that member states look to move towards comprehensive legislation around marketing to children, because only enforceable regulations have sufficient authority to ensure a high level of protection for children. Okay, so in terms of our recommendations, you can see here in the centre of this slide that our central recommendation is for comprehensive legislation. And as I mentioned before, this is detailed in the World Health Organization's report. They put forward a number of different options for legislation in both the comprehensive category and also a category that they call stepwise moves. We in the group favoured an option for comprehensive regulation which restricts marketing of all foods and beverages to children. The reason why we settled on this one was because it's simple to interpret and it gets around all of that discussion about what is healthy, what is not healthy, how to classify different foods. So it just cuts through that. We recognise that it would stop marketing of healthy foods as well, but we think that the best place for messages about food and nutrition are through families and through health agencies rather than commercial entities. So down the left-hand side of the slide you can see the enablers that lead to the actions, and then on the right-hand side of the slide the outcomes that we're wanting to achieve.